Why the Terrain Advocacy Program? Years ago, while I was still in private practice, I was lucky enough to have a patient coordinator. That made all the difference from how well my patients were able to be onboarded into my clinic, supported through their entire journey as a patient at my clinic, and who helped me stay in touch with the patients between our visits so that questions didn't fall through the cracks or urgent matters weren't lost until our next visit. Fast forward in 2015, I launched my first beta program for advocates, for patient advocates. At that time, it was called ICAN, Integrative Cancer Advocacy Network. I had 10 clients that had followed me for a very long time on this journey who decided they wanted to turn this into helping others do the same. So they were my beta, and they did it beautifully, but there weren't enough of them. And so what we've had to do is, now that we've trained physicians, now almost 200 physicians in 28 countries, we also need to have enough patient advocates to support those physicians to support their patients. The advocate plays the beautiful role between holding the hand of the patient and the hand of the physician so that everything can be seamless from the very first visit for the many follow-up visits to follow, and to have a helpful, successful outcome with onboarding things like dietary, lifestyle modifications, understanding when and how to order your labs, how to speak to your community, to your oncology team, and to your family, how to advocate for yourself, and what tools and tricks can help you have more optimal experiences as you're going through the process with your physician, who is doing all the testing to assess your patterns to best find your treatments. The advocates are also trained on helping that patient understand the why of their condition and the why of the therapies that they've brought on board. We see the advocates as an invaluable resource to both the clinicians as well as the patients, and we need more and more of you to help make this network grow globally to continue to serve the demand of patients seeking help from a metabolic approach to cancer. So by now, if you're interested in the advocacy program, it's because you've already either one, read the Metabolic Approach to Cancer book, two, seen me on several podcasts, three, worked with one of our doctors who've come through our physician training program, and you're curious as to how you can apply this more into your own life or that of your loved ones, or to actually help support other clients on the journey of cancer and metabolic dysfunction. So the book itself is just a highbrow overview, but it doesn't really give you the tools of how to actively survey, support, and partner with a clinician and a patient to help them have better outcomes. That's what our course is all about, is giving you the tools to follow along the same trajectory that our physicians do of the test, assess, address methodology, but in bite-sized ways that make it more tangible for you as an advocate, or sort of a coach-like role can play in helping ensure the success of a patient and their process with the doctor. Do you have any background medical training? Are you a nurse? Are you a physical therapist? Do you have a degree in clinical nutrition? Have you yourself been a patient dealing with cancer, but have a really good grasp of the sciences, maybe worked in some adjunct scientific community, or have some type of a medical certification of some sort, but you're not quite at the level of a clinician where you're able to order labs and imaging and prescribe pharmaceuticals and diagnose and treat disease? If you fit in that first category, you are the perfect candidate to join our Train Advocacy program. We'd love to have you. You would be a great voice to add to our community and a great resource to so many patients looking to get more connection to their physicians in applying the metabolic approach to cancer. Statistically speaking, half of us will face cancer in our lifetime. Currently, there are 12,000 oncologists in the United States, maybe that many more globally. We're unable to meet patients diagnosed with cancer at the rate we're already experiencing, and that's just getting amped up. More to come. The physicians who've come through our training, the Metabolic Approach to Cancer training, to this moment, we have almost 228 countries. They can't keep up with the demand. We can't meet the demand and make the referrals. We don't have enough human bodies and hours of the day to serve those that are desperately needing a metabolic approach to cancer. The advocates are absolutely critical to helping patients while they're in the waiting room to see one of our physicians. When I left private practice and moved into consulting, part of the reason I had to leave private practice was the burden I carried, the weight I carried of how many people literally died in my waiting room because I couldn't get them in fast enough. I had over a year-long waiting list. And most of our physicians that have come through our training program are looking at a 6 to 12-month waiting list as it is, unable to keep up with the demand and the ongoing massive flood of people begging for this type of care. You, as the advocate, can help onboard those patients, get them primed, get them ready, start on some very tangible day-by-day approaches to help them become successful and to prepare them for the moment that they are sitting in front of that physician. Many of our patients, just by reading the book and working with an advocate, have already slowed down or even turned around the cancering process. That's even before they've had their first visit with their physician. So we see you as a critical stopgap, and we also see you as a critical ally to both the patient and the clinician in the meeting of the massive pandemic that we're all facing in the world of oncology and metabolic disease.